stuck on the low FODMAP diet and wondering if you'll ever eat normally again? Reintroducing foods can feel really confusing and honestly a little scary. In this video, I'm going to guide you step by step through reintroducing foods safely after a low FODMAP diet. We'll cover when to start, which foods to add back first, portion sizes, what to do if you react, and how to safely expand your diet. Then stick around to the very end because I'm going to share one major truth that could save you months of anxiety and frustration while reintroducing foods. What's up and welcome to the video. I'm Dr. Daniel Ricciardi, gut health expert, licensed pharmacist, fitness enthusiast, creator of SIBO shortcut and the gut health supplement Bloat Blocker. This video is going to cover everything you need to know about transitioning from the low FODMAP diet back to your normal diet, as well as provide some useful tips on supplements and SIBO prevention after you eliminate SIBO. Getting started, what is the low FODMAP diet? The low FODMAP diet is a temporary elimination diet that's designed to reduce fermentable sugars and fibers. For someone with IBS or SIBO, these could be foods that cause bloating, gas, and irregular bowel movements, such as constipation or diarrhea. FODMAP is just an acronym for the different types of fibers and sugars that can fall into this category. What can the low FODMAP do and what is it unable to do? The low FODMAP diet is meant to provide mild to moderate improvement of symptoms in patients with IBS and SIBO. However, it is not a SIBO cure, and frankly, is not really meant to be a long-term diet. Using it long-term may risk depleting certain good bacteria, which can have a negative impact on your microbiome and intestinal health. As I mentioned, the low FODMAP diet reduces symptoms, but is not meant to be a cure for SIBO. Once an overgrowth like SIBO or IMO, methanogen overgrowth, is gone, generally for most people, adding back more fermentable foods like these FODMAP foods has a positive impact on their microbiome diversity and gut health. When should you begin reintroducing FODMAP foods? I would start reintroduction of higher FODMAP foods right after your SIBO or IMO overgrowth is eliminated. Usually it's good to have a SIBO breath test just to verify this, but it's not always required. Hopefully you'll also have some symptomatic relief before adding back these FODMAP foods, but this is not always the case because sometimes even after SIBO or IMO is eliminated, there's still some lingering leaky gut and intestinal inflammation that can attribute to gut symptoms. Nevertheless, if this is the case, it's still okay to begin reintroducing FODMAPs. Which FODMAP foods should you add back first after doing the low FODMAP diet? There's not one universal must-follow rule for this. The method I use with my clients is to have them rank all the foods they've eliminated either as a 1, a 2, or a 3, where the 1s are the foods you feel most confident you can add back and you won't have issues, 2s are moderate, and 3s are the ones you feel kind of apprehensive if you add this food back, it may not go really well. How this process would work would be you'd start with a food ranked number 1. Let's say a person picked bananas as a food that they rank number 1. You would add bananas back on day 1 and consume a normal portion size twice daily. So maybe this means for breakfast and lunch or for lunch and dinner, however you want to do it. The serving size for bananas is pretty straightforward. I would just do 1 banana with breakfast and maybe 1 with lunch. For other foods though, it's not quite as self-explanatory. Some examples you may want to go with would be a piece of fruit, a cup of berries, a quarter cup of nuts, half cup of cooked vegetables. I like to do cooked vegetables only during this food reintroduction phase and not raw vegetables because they're harder to digest usually. So you do this on day 1 and then repeat it again on day 2, followed by none of this food on day 3. Assuming the reintroduction for banana went well, you'd add another food back that you rank number 1 on day 4. Only adding a food every 3 days allows us to check for both immediate reactions, such as your stomach gets upset after you eat it, or delayed type reactions, which could be things like significant fatigue or brain fog or some type of skin reaction, which can happen in the 24 to 72 hours after eating it. This typically is in line with a food sensitivity. So you're going to continue adding foods back in this manner until all the 1s are done, and then you're going to transition to adding in the 2s, and then finally the foods that you rank number 3. Important note, this is just my preferred way of doing this. You do not need to follow this structure exactly. Typically, as you start reintroducing foods, you get a pretty good sense of how your body's going to respond and if the process is going to go smooth. If things are going well, feel free to add foods back a little bit quicker or even add multiple foods on the same day. Eventually, you should gain more confidence in your body that it's going to be able to tolerate more and more things. What to do if you react to a FODMAP while reintroducing it? If you notice symptoms from a food, either right away or in the 24 to 72 hours after consuming it, stop that food reintroduction for now. The truth is, food tolerances can change over time. Continue with the gut healing protocol, which is a protocol of supplements that you are doing. And then you can try to reintroduce this food again in 1 to 2 months. Sometimes your intestine just needs a little bit more time to heal before properly digesting specific foods. And in some cases, even without SIBO or IMO being there or some sort of overgrowth, you may find that that a food just doesn't agree with you. For me personally, I just happen to not digest foods such as beans or hummus that well. Not a huge deal. I just tend to avoid them and I feel fantastic otherwise. Quick note, if you have a true allergic reaction to a food such as hives, facial swelling, or trouble breathing, do not try to reintroduce this food again in the future. For a gut healing protocol of supplements to do after healing SIBO or IMO, there's one link down in the description of this video you can check out. And then a key supplement that I love for helping heal the gut, reduce IBS symptoms, and prevent SIBO from coming back is one that I personally developed. It's called Bloat Blocker, and it consists of tamarind seed, which contains a special type of starch called xyloglucan, and it also has a very tiny amount of pea protein powder, about 100 times less than a typical pea protein supplement. So if you're thinking, but pea protein gives me major stomach upset, I don't like it, this supplement only contains the tiniest amount needed to give your gut protection, but not be a burden on your digestive tract. These ingredients work by protecting the mucus layer in the gut lining. So it's focusing on root cause gut health to help with normal bowel movements, less bloating, and even make it more difficult for bacteria to form biofilms on the lining of your small intestine. I've been taking this twice daily for the past year and I've been loving it. If you want to check it out, links below, blueorchardwellness.com. How long should it take to reintroduce all the high FODMAP foods you eliminated while doing low FODMAP? This process can take anywhere from a few weeks to a few months, depending on how many foods you eliminated and how your body responds when you start adding back those foods. Also, using some sort of gut healing supplement protocol, like the one I mentioned in the description below, can help speed up this process. Lastly, if there's one piece of information I really want you to remember from this video, it is this: if you get bloated or feel really lousy after having a high FODMAP meal, does this mean that you ruined all of your progress? If you feel crappy after doing a food reintroduction, that does not mean that you ruined your progress. It just means that that specific food isn't agreeing with you right now as you heal your gut and reduce inflammation in your digestive tract. Remember, you treated the bacterial overgrowth and got rid of those bad bacteria that we don't want, which was the overgrowth of bacteria such as Klebsiella and E. coli. And right now we're just adding back foods in that are actually going to support other good bacteria in your microbiome, which is useful for preventing SIBO. To take this one step further, even if you have active SIBO or IMO, eating a high FODMAP meal or cheat meal, or maybe you just don't feel good after going out to eat, that does not mean that you dismantle all of your progress. Please do not stress about this. It just means that you cause yourself temporary symptoms, and it'll make the reintroduction process way less stressful. That is all for today. If you enjoyed the video or found it helpful, please like and subscribe to my channel for more related content. In the comments section down below, let me know what questions did you have, and if you've done this before, which strategies have you found to be most helpful. Thanks so much for watching, and I'll see you in the next video.